Hello, I'm Dr. Atsai with a new case on sonography. We have a triplet pregnancy for anomaly scan. Don't forget to subscribe me if you want to see my new cases on every Monday. And of course, don't forget to like and be free if you have any question, ask me on comments. We have a patient with triplet pregnancy. At first, we will look an overview on all fetuses in every multiple pregnancy. It does not differ of the age of the fetuses. First of all, we will have a review without any magnification. So, we have a fetus on top, a fetus in middle, and the third fetus is here in lower abdominal, lower endometrial cavity. Here we have the placenta of one fetus, this one another placenta, and this one the other placenta. If we look, we can see a membrane separating each fetus from adjacent fetus. Here it's clearly seen. And this one is another membrane. This is the fetus A, this is the fetus B. We can see every limb of the fetus. For example, here is the hand of the upper fetus. It comes near this membrane, but it cannot pass to the sac of the middle fetus. It means that each fetus has its own gestational sac without any interfering to the other fetus. So the fetuses are 3 chorionic, 3 amniotic fetuses. Here is another example. You can see the head of this fetus adjacent to the membrane, and also the hand here, but it cannot go through the membrane to the other gestational sac. And of course, we have endocervical canal here. If we have some magnification, we can also measure it. It is about 38 millimeter, which is normal. You know that it should be above 30 millimeter. And of course, transvaginal sonography would be more precise for measuring the endocervical canal. So we'll start from the first fetus lying on the top here. Again, you can see that this is the fetus A, fetus B is in the middle, and fetus C is in the lower endometrial cavity. We will begin from fetus A. We should magnify to have a better view of the fetus here. We'll check one by one the different parts. Here we can see the brain of fetus A. Here is the cerebellum. We measure it, it's about 18 millimeter. More magnification. Here is the lateral ventricle. it's about 6 millimeter, which is normal. You know, less than 10 millimeter is normal. We can see corpus callosum. Here, the lines of septum pellucidum are seen. And what else we can evaluate, and it's important, is the vermis of the cerebellum for ruling out any Dandy-Walker syndrome. And also third ventricle, fourth ventricle are not dilated, so the brain of fetus A is okay, normal. So we'll continue to other parts of fetus A. In this view, we can see the lips here. See, the mouth is moving. So here we have lips. One eye of the fetus can be seen here, which is the left eye. Here, another eye, of course, the right eye of the fetus. Is here. Again, we can see the lips around the nose. No sign of any cleft. Here the upper lip. We saw the eyes. So we'll continue to the limbs. Here is the left hand. We can count the fingers also. The fetus is moving. We have a good view here of the 5 fingers. Here is the right hand also. You can see the thumb and 4 other fingers. Also we can see other parts of the upper limb. So here we have a view that we can count the fingers also. Here is the thumb and 4 other fingers. We'll check it again as the fetus moves and have a better view. So we'll continue down to the abdomen. Here we can see the urinary bladder and the stomach. The bladder here, the stomach here. We see the diaphragm as a line here. Of course, the stomach should be lower than the diaphragm, not in the chest area. So we have diaphragm here. We can see the spine from neck to the chest, and especially the lumbosacral area of the spine, it's intact. The bony structures are intact, no defect or cord hernia or any sign of sphingomyelocele is noted. So we have here the spine. Of course, we should have a profile view of the fetus. Here we have, in this view, we measure the nasal bone here, and also we see the, here we have nasal bone, and also we check the chin. Here is the chin, not to be any micrognathia or any other problem. Measuring of the nasal bone is important in profile position, as Down syndrome patients have a small nasal bones. So here we can count the fingers of the right hand. So we have here the right hand of the fetus. And we have the left hand here. Again, the thumb here and 4 other fingers. Again, profile position, the nose, the chin, one eye, upper lip, another eye. And how can we understand that is the right hand and that is the left hand? Easily compare it to the place of the stomach. Here is on the side of the stomach, so it's the left hand, left eye again, left ventricle, everything, left kidney. So we compare with the position of the stomach. So in the abdomen we will look for the kidney, here we see the left kidney. The size of the kidney is 18 millimeter, which is normal. No hydronephrosis is noted. And here is the another kidney, of course the right one. We'll continue to the heart. We should see the 4-chamber view of the heart. Here, 2 ventricles, and see the 4-chamber view, which is normal. Of course, the axis of the heart should be to the stomach, which is the normal axis. We'll check the ribs here. All the ribs are intact. So spine is here again. And we'll check the sex of fetus. Here you'll see the 3 line, 1 line in the middle and 2 other lines, so it's female. Here it's obvious. Then we'll check the feet. Here we can count the fingers. This is the thumb and other fingers. Another feet, the toe and other fingers can be easily seen. We'll check not to be any deviation or any club foot in the fetus. See the axis of the foot to the axis of the leg is normal in both legs. Again, the fingers of the foot and another foot also. We'll check the umbilical cord for 3 vessel pattern and here we see 3 vessels, so it's normal. Of course, the insertion of the umbilical cord to the abdomen is very important for any probable abdominal herniation. So here was the fetus A. Again, the lips, both hands, the 5 fingers, another hand, chin, another eye. We'll also look here to the abdomen, not to be any cyst or mass or anything else in the bowels. The echogenicity of bowels are normal, not to be hyperecho. Everything is okay. We'll look at the chest area also, not to be any mass or shifting of the heart or any changing in the echogenicity of the lung or any liquid or effusion in around the heart or also around the lungs. So everything is clear here. So we'll continue to the second fetus. This is the middle fetus. We see the spine here completely intact, especially the lumbosacral area. The urinary bladder is here, stomach is here. Of course, here we have the diaphragm. The stomach is lower than the place of the chest, so it's in proper place. No hernia is noted. Here we can see the left kidney. Here is the right kidney. From here to here. Minimal pelvic fullness in the kidney helps us to localize the kidneys. For the size of the kidneys, we have charts, but in 18 week of gestational age, between 18 millimeter to about 26-24 millimeter is normal. We have the 4-chamber view of the heart. Again, 2 ventricles, and we have the brain, the cerebellum, corpus callosum, lateral ventricles, no ventriculomegaly. You can count the fingers here, Another fingers are here. We should be careful not to mistake any fetus hand to the hands of the other fetus. See here, we can again see the membrane. So this is the hand of fetus C, easily seen, not fetus B. We are looking for the hands of fetus B. For not to be have any mistake, we can easily follow the fetus hand that we are investigating from the trunk. See here, we follow. Here is the hand of our fetus we are looking for. So 5 hands, 5 of course fingers. So we have the foot of fetus B, 5 fingers. Another foot here, again 5 fingers, the toe and other fingers. The sex of fetus B, again a female. It has the picture like coffee bean or tree line. See, it's like a coffee bean, so it's female. Here's the face, the lips. Here you can see no cleft in the lips. Here is one eye, of course the right eye, as the stomach is here, so here is the right eye. The lips are intact. We cannot check the left eye because the position, yeah, now it's better. We can see the left eye also. So everything in fetus B was also here is the sex again of the fetus B. So fetus B was also healthy with no problem. Again, we can check the hands. See, this is not the hand of fetus B, these two. Here we have the hand. See, the membrane is moving here, the hand. These are the hands of fetus A we have checked. So this is the membrane. It cannot come to the sac of the fetus B. So we'll continue to fetus C. Here again we have the brain, lateral ventricles, corpus callosum, of course septum pellucidum, fourth and third ventricles. We can see again the spine, urinary bladder, stomach, the line of diaphragm, the position of stomach, one kidney here, it's clearly seen. It's the left kidney adjacent to the stomach. And here is the right kidney. The feet. Here 1 foot. here the other foot. You can count the fingers also, no clubbing. Here the axis is in normal range. Count the other foot fingers. The fingers of the hand and the other hand also, it's moving. Yeah, here is the thumb, another fingers also. So everything in all the 3 fetuses are normal. Of course, we'll check all of them many times in different positions. When the fetus change position, we can check it more and more, but here we had a short review. See the eyes, here another eye, nasal bone, lips, upper lip, lower lip, and also we can wait for fetus to change position for a profile view. Everything was okay. Membrane, you can see this was the fetus C, fetus B, and fetus A. So don't forget to subscribe me and like the video. Every Monday we will have a new case on sonography. And of course, if you have any question, be free to ask me in comments. See you.